In almost every general election since independence, the PAP has held a rally near Fullerton. We usually hold it after the midpoint of the campaign. It's an occasion to pause, take stock of what has happened in the hustings so far, and refocus everyone's minds on what is at stake. Unfortunately, because of COVID-19, we cannot convene a physical Fullerton rally this year. So I have to speak to you virtually, online. But my purpose is the same. Hardly ever in our history have the stakes been higher than now. We are in the middle of a crisis. But as tough as the past months have been, our biggest challenges lie ahead of us. Globally, COVID-19 cases continue to surge. We don't know how the pandemic will end or whether a lasting solution will be found, be it a vaccine or more effective treatment. We face a continuing danger to public health, and this will also weigh heavily on the economy for perhaps a year, if not longer. All our experience since the beginning of this year has made clear just how important a good government is to fight COVID-19, support the economy, and get out of this crisis intact. This is what this election is about. Whom do you trust to get you through the very difficult times ahead? Our COVID-19 situation is stable. Our healthcare system has held up well. Our fatality rate is among the lowest in the world. In the migrant worker dormitories, the outbreak is being systematically cleaned up. We have managed to get to this stage not by chance, but by dint of immense effort. First, we've been preparing for a pandemic since SARS. We systematically built up our resources and capabilities, stockpiling masks and PPE, training healthcare workers, practicing contact tracing and reporting. For 17 long years, we sustained these preparations. We dealt with H1N1, we prepared for Ebola and MERS. We never took our eyes off the ball. So when COVID-19 hit the region and the world, we had a good base to work off. But every disease is different. COVID-19 is not the same as SARS. It's less lethal, but far more infectious. The post-SARS preparation was essential, but not enough. When COVID-19 hit us, we had to scramble. One challenge was to secure more face masks amidst a worldwide shortage. Another was to ramp up testing so that we could detect new cases faster and stop them spreading. Countries had banned the export of instruments and chemicals needed to run COVID-19 tests. We had to ramp up labs, set up new ones. We had to manufacture more test kits and accurately process the results. We recruited and trained swab teams to perform the thousands of swabs needed every day. Behind the scenes, this was a highly complex operation. For now, test capacity is no longer a constraint for us, but we are still building up reserve testing capacity, just in case. Despite our best efforts in April, the virus broke out in our migrant worker dormitories. The large numbers pose a real risk of overwhelming our hospitals. We had to mount a huge operation. We mobilized the SAF and home team to help manage the dormitory situation. We even opened up SAF camps to house vulnerable workers and keep them safe. We arranged for every worker to be fed, cared for, and paid on time. We built new isolation and medical facilities. Within weeks, we created almost 30,000 bed spaces in the Changi Expo, at PSA Tanjung Pagar Terminal, and elsewhere. More bed spaces than all our acute hospitals put together. All these extremely demanding tasks had to be performed in the fog of war. We had to decide and act urgently based on incomplete information. The public service, including our healthcare workers, the SAF and home team, responded magnificently. They took directions from the multi-ministry task force led by Gan Kim Yong and Lawrence Wong. At every step, we faced difficult trade-offs between lives and livelihoods. Crucial decisions had to be made. It was the ministers who made these decisions and were accountable for them. One major decision was whether to impose a circuit breaker. Doing it would come at a great cost to jobs and business. But not doing it meant risking a major outbreak and loss of lives. We had to decide one way or the other before it was obvious, much less certain, that cases would shoot up. It was a big decision. Kim Yong and Lawrence brought the matter to Cabinet. The Cabinet discussed it, weighed the pros and cons, and decided to go ahead. As it turned out, we acted just in time, as the numbers were growing, but before they shot up dramatically. The implementation of the circuit breaker, too, was not straightforward. How to cushion the huge impact on jobs and incomes? How to do home-based learning for students? How to get Singaporeans to observe the necessary but painful measures? I did a live TV broadcast to explain to Singaporeans why we were imposing the circuit breaker and to ask people to please play your part and stay home. This was a political decision, not an administrative one. The ministers and ultimately the PM and Cabinet have responsibility. Without a team of capable ministers working closely together on all these different aspects, we wouldn't have been able to implement the anti-COVID measures. We would have lost the confidence of Singaporeans. And you've seen this happen many times elsewhere. Political leaders fail to act competently. Voters lose trust in them. They are confused and dismayed. Their faith in the whole system is shaken. People suffer greatly and many die unnecessarily. Singapore has avoided this. We are in a better position now. But even as we reopen after the circuit breaker, we cannot afford to take chances. The danger is still very much alive. In many countries, after lockdowns were relaxed, cases have flared up again. And if there's a second global wave of the pandemic, we may be hit hard again, despite our best efforts. Keeping COVID-19 under control and our people safe, avoiding another lockdown, will take everything that we've got. We'll have to make many more difficult decisions and find more creative, radical solutions to take care of our people. At this moment of danger and alarm, the opposition parties are talking as if we can just keep to our old ways and the crisis did not exist. They show no recognition that we are facing the crisis of a generation. They've been completely silent on how to tackle COVID-19, both during the last 6 months and in this election campaign. What contribution will they make in Parliament? Adding contrast to the discussions, they say, if they get elected as MPs. What will happen to Singapore if they formed the government.